Hi, my name is Juan Barraza. I'm the founder of Video Interpreters. 5 years ago, during the influenza outbreak, I was working the night shift at one of the trauma hospitals here in Portland. I was the only medical interpreter working on the staff, and the floors were at full capacity. Every few minutes, my pager will go off and alert me there was a new interpreting request coming on. And believe me, they still use those at the hospitals. As I rushed from one floor to the next, I really wish I could have a transporter that could send me from one floor to the next in a matter of seconds. Hollywood, through movies like Star Wars to Star Trek, has shown us new innovative technologies and new galaxies far, far away. And it shows advancing technology that we only dream about when we're kids or as adults. We've seen flying cars, holodecks, lightsabers, and despite all this innovation around them, we still face the same problem that every civilization faces around language and speech. They're always surrounded about multiple technologies and cultures, and they need to find a form to communicate, creating new devices and technologies to help them bring down the language barrier. We're facing the same problem. Despite all the innovation around us, we still have a language barrier in our communities. The medical interpretation industry hasn't embraced new technologies lately. In fact, traditional forms of interpretation haven't changed in decades until now. Mobile health is the new medical frontier. At Video Interpreters, we have combined teleconferencing with cloud and mobile computing and created a video medical interpretation platform that can connect medical staff, patients, with a qualified video medical interpreter. Telepresence is not new to healthcare. It's only until now that has become affordable and scalable and easy to deploy. But technology is only part of the equation. Doctors' offices, hospitals, and patient care centers today deal with a diverse mix of ethnicities, cultures, and spoken languages. In healthcare, good communication is essential for good quality care. And improving the language services offered to our patients is crucial to improve communications and better health outcomes. By partnering with a medical interpreter, you get more than just interpreting a conversation. Partnering with an interpreter provides with an interpreter a deeper cultural understanding. When we partner a medical provider and a video medical interpreter, it gives us a very powerful tool that will allow us to partner with parents with kids diagnosed with leukemia, to talk face-to-face with an advised nurse and an interpreter while they're on their way to the hospital, because she spiked a fever in the middle of the night after her chemotherapy treatment. It would allow an advised nurse to talk to an elderly patient with limited English proficiency, allow them to assess their condition and the causes that will help them have a better health outcomes. It will allow first responders to team up with our trauma teams, providing them with an interpreter on site when dealing in emergency situations. It will allow hospitals and providers across the nation to have access to a qualified medical interpreter in seconds rather than minutes, expediting the health care of patients in our diverse communities. In the US, 8% of the US citizens have limited English proficiency. That is to say, 25 million Americans speak or understand little but limited English, and they need a qualified medical interpreter, and the need is growing. The language barrier is there, but partnering medical interpreters and video medical interpretation, this barrier will be easier to overcome. So next time you're in a place where you don't speak the language, or you encounter somebody that has a limited English proficiency, and they need help, you will not need to dream for help from a galaxy far away. Help will be within the reach of your fingers. Thank you.